Hello, welcome to SkepVet TV. I'm Dr. Brennan McKenzie and I'm the SkepVet. Today I'm going to talk about acupuncture. This is an enormous subject. There's a huge body of research literature on acupuncture, both in humans and to a lesser extent in veterinary animals. There are obviously lots and lots of opinions on the subject. It's probably one of the most popular of the alternative therapies that are out there today. Okay, so let's cut to it. What is acupuncture? One of the biggest problems with acupuncture is it's really hard to define. We all have some image in our head of people sticking needles into other humans or animals as a way of trying to influence their health, and we call this acupuncture. But the reality is it's been very difficult to define what acupuncture is. Some people use needles alone. Some people use needles with a process called moxibustion, where they burn mugwort or other plants on the tip of the needle to heat it up. Some people use electrical stimulation through acupuncture needles. Some people inject substances at supposed acupuncture points. So there's no consistent definition of acupuncture. Some acupuncture schools only needle the ear or only needle the foot. Pretty much every part of the human body except the genitals and the eyeballs has been used as an acupuncture point in some practice somewhere. So it's very difficult to define what acupuncture is. Short, sweet, I will say acupuncture is the use of needles with or without other attachments or processes to affect health. The most common theory behind the use of acupuncture is what's called traditional Chinese medicine. This is a bit of a misnomer. It is true that people have used acupuncture on other humans for thousands of years. However, the original practices of needling come from bloodletting techniques that were used in ancient China, and the use of fine, delicate needles was something that developed later. So there is a changing history here. It's not as simple as somebody invented acupuncture thousands of years ago and it's been unchanged ever since. It's also true that the practice of what's called traditional Chinese medicine is actually a hodgepodge of competing folk medicine traditions that were cobbled together mostly for political and historical reasons in the 1950s and 60s in communist China. There's some interesting articles on this history which I'll link to below and which I've discussed on my blog. So there's not exactly a true traditional acupuncture practice that has been unchanged for thousands of years. Interestingly, traditional acupuncture, insofar as such a thing existed, the way acupuncture was used in ancient China, generally was not applied to animals. Acupuncture was believed to be a method of adjusting imbalances in spiritual forces that affected health. Animals were considered to be objects, not beings with spiritual natures, and as such were not typically treated with acupuncture. There are some resources that talk about using sharp metal objects on horses, and those have been pointed to suggest that equine acupuncture was popular in ancient China. But in fact, close translation and research into those sources has shown that that was more of a bloodletting or a firing technique, using heat to burn areas on the skin, not the use of these delicate needles that we think of in modern acupuncture. The problem with traditional Chinese medicine, other than its somewhat cobbled together and ad hoc history, is that it relies on a set of theories that don't really have any basis in science. The idea of vital humors, things like wind and damp and spleen and liver and heat and cold affecting health, is a set of pre-scientific metaphors that people used when they didn't really understand biology, when they didn't understand how health and disease actually worked the way that science has let us understand it today. And there's no real evidence that these metaphors actually correspond to anything in the real world. If you are needling a dog in order to adjust its qi or reduce wind or tonify spleen or whatever, there's really no evidence that any of that is real. And that's not a very solid foundation for a medical therapy. Another problem with the traditional Chinese medicine approach to acupuncture is that because it relies on these unscientific metaphorical concepts, oftentimes traditional Chinese medicine practitioners deny the scientific explanations for disease or recommend not following scientific medical treatments. People will tell clients of mine who go to them for acupuncture to stop giving their pain medications or to switch to raw diets or to use herbs instead of drugs. And all of these are part of a metaphorical and metaphysical folk belief, not true scientific medicine. So if you are looking at acupuncture for your pet, I would be very wary of anybody who practices from a traditional Chinese medicine perspective, because they're not basing what they do on any real science, and in fact, they're basing it on a whole set of ideas that cannot be true unless we simply throw out all of modern science. Now, there are people who study acupuncture from a more scientific perspective and who have tried to come up with theories for how needling might affect health that don't rely on these metaphysical, Taoist religious principles that traditional Chinese medicine still relies on. There's no question that needling does things to the body. If you stick a needle in your body, it has effects on your nerves and on your muscles and on your skin. It impacts receptors of various kinds. It leads to the release of chemicals of different kinds. So there is an actual physiologic effect to needling. And it's reasonable to ask the question whether this effect can be understood scientifically and whether the benefits potentially for health can be predicted and demonstrated through science. The form of acupuncture that I trained in is called veterinary medical acupuncture. This is a subset of acupuncture technique, pretty much a minority in the veterinary field, that tries to look at acupuncture from this point of view. It does unfortunately start with practices that were developed from the traditional Chinese medicine approach, but then it tries to look at what those practices accomplish from a scientific point of view and adjust them accordingly. I do think this is the most reasonable way to approach acupuncture, but unfortunately it's not how the majority of acupuncturists currently practice. So if we are looking at acupuncture from a scientific point of view, one of the first questions we have to ask is, are there acupuncture points? Is there such a thing as an acupuncture point or a channel or meridian? Does it matter where you put the needles in order to have the effect? Because the whole concept of acupuncture is based on the idea that you can have predictable, meaningful effects by putting needles in certain places. You're not just randomly poking needles wherever you feel like it. There are actually designated places on the body that you're supposed to needle in order to have your health effects. Turns out it's been very difficult to show that these points actually exist. A lot of acupuncture studies are done using other points that are not considered real acupuncture points as control. And many of these studies have found that it almost doesn't matter where you put the needles. You'll get some effect either way. This makes the idea that there are reliable acupuncture points that you can point to and manipulate and use to predictably affect health kind of questionable. Also, studies have been done looking at places that are considered acupuncture points and trying to find if there's any physiologically special thing about these places. Some authors have claimed that they have found this, but unfortunately there's not really a reliable literature showing that historical acupuncture points actually have a unique physiologic identity. Many of them run along blood vessels because acupuncture originated as a bloodletting technique, and blood vessels have nerves that run along with them, so we can make the argument that maybe these are ways of stimulating the nervous system along nerve tracks, but that's a little bit like the idea of saying, if I drop a net somewhere in the middle of downtown London and I catch a few people in that net, that the point that I drop that net is a special point because that's where the people are. When in reality, I could probably have caught people anywhere had I dropped a net anywhere in a city as busy and crowded as that. There's almost no place on the body that there isn't some sort of important physiologic structure. So I think it's a little bit debatable whether this idea that acupuncture points are physiologically or anatomically special is true. I think in reality, it probably is not. Of course, what most people are concerned about is not the nitty-gritty of the theory behind acupuncture, but does it work? And there's a problem with trying to study acupuncture that's a little bit unique. The traditional way of studying something scientifically is to do what's called a placebo-controlled trial. We know that people tend to experience what they expect or hope for with medical treatment. So if I give somebody a pill and say this is going to relieve your pain, they take the pill and then later they tell me their pain feels better. And this is often true even if the pill I give them has nothing in it at all. This is a variety of placebo effect, and I've talked a little before on the channel and also on my blog about placebos. The same happens in animals, either directly through a variety of behavioral effects or indirectly because humans are easily misled into believing that our pets feel better because of what we've done, whether they actually do or not. There is a caregiver placebo effect. Acupuncture is difficult to study in this placebo-controlled way because it's very difficult to convince people that you've stuck a needle in them when you actually haven't. As I mentioned earlier, studies have found that oftentimes if you needle at points that are not considered real acupuncture points, that are called sham acupuncture points, you get the same effect as if you needle at the real points. So part of the problem with doing placebo controls is it may not matter where you put the needles. Other studies have tried to use things like retractable needles or poking with toothpicks instead of needling to convince people that they've had acupuncture when they actually haven't, and use that as a placebo control. It's very difficult to make that work. It's very difficult not to needle somebody and then have them think that you have. And in fact, acupuncture studies almost always involve people who are very positive about acupuncture, who already believe that it works and are ripe for placebo effects. So in humans in particular, it's been very difficult to do good placebo-controlled studies. There are studies in humans showing that, in fact, what the acupuncturist says to a patient about what they're doing has more effect than what they actually do. If they tell someone, this is acupuncture and this is really going to help you, that has more effect than whether they actually do the real acupuncture or some kind of fake placebo. There have been hundreds and hundreds of studies in humans looking at acupuncture, and reviews of those studies have been really mixed. There are some studies that seem to show an effect, and there are other studies that definitely do not. The problem is that the studies that do the best job of controlling for these placebo effects show the least effective acupuncture. So unfortunately, right now the evidence for acupuncture in humans, where there are hundreds of studies that have gone on for decades, is not great. It's really hard to prove that acupuncture actually does very much. That's a problem. Now, what about the studies in veterinary patients? Well, as is always the case, there aren't nearly as many as there are in humans, and the quality of the studies is not very good. For the most part, we have not been able to show really convincing, repeatable benefits in good quality studies in dogs, cats, or horses, where most of the research has been done. Some studies do apparently show effects, but it's easy to find uncontrolled placebo or other errors in those studies. The best studies, generally speaking, don't show very convincing evidence of effects. The other question that we always ask about any therapy that we should ask about acupuncture is it safe? If we're not clear if it has any benefits, or if its benefits are small, that might matter more or less depending on whether it has risks. So what are the risks of acupuncture? This is also a subject that's been studied, and there's some debate, but for the most part, I think we have a pretty good handle on the risks of acupuncture. In general, acupuncture is pretty low risk if it's performed by somebody who has a basic sound knowledge of anatomy. Now, there have been some really serious side effects to acupuncture. People have died from acupuncture. These have usually been cases in which acupuncture needles pierced the chest and let air in, so people's lungs collapsed and they couldn't breathe, or where acupuncture needles pierced what's called the pericardium, the sac around the heart, which filled up with blood and squished the heart, and people have died from that. In a famous case, the former president of South Korea had to have surgery to remove one of his lung lobes because an acupuncture needle had migrated from his chest wall into his lung and created an abscess or an infection in his lung. So acupuncture can have really serious risks, but most of these are associated with poor technique or with just the craziest ideas out there, things like leaving acupuncture needles in permanently. Most of the risks that have been documented with more reasonable and more anatomically guided acupuncture therapy have been pretty minor. Acupuncture can cause local infections, pain. People do sometimes report dizziness or nausea or fainting associated with acupuncture. So there are some risks to acupuncture, but as long as it's done carefully, they're relatively small. So what's the bottom line? The bottom line is that the theories behind acupuncture that come from traditional Chinese medicine are unscientific and almost certainly not really true and not useful. The more scientific theories behind acupuncture are more reasonable and plausible, but it's been very difficult to prove that they're actually true. And in fact, the idea of a special acupuncture point that you can manipulate to have an effect has turned out to be really hard to prove. Lots and lots of clinical research has been done in acupuncture, and for the most part, the better the study controls for errors and placebo effects, the less likely we are to find a benefit. So it's been really hard to show that there's actually practical benefit. Now, it's always possible to say that more studies might turn out to show real benefits, but when you've been studying something for decades in hundreds and hundreds of trials involving thousands of people, and you still can't really prove that it works, that suggests that there's not much benefit to be found. What benefit there is probably small and probably limited to subjective symptoms, things like pain and nausea or fatigue that are amenable to placebo effects. The veterinary acupuncture literature is quite limited, small studies with lots of methodological problems, and it has not certainly proven any convincing benefits to acupuncture in animals. Overall, I think acupuncture is pretty safe. It probably doesn't do very much. At most, at best, it should be used as an add-on, as a supplement to therapies for which there's better evidence. If you're using acupuncture to treat pain in your old dog with arthritis, that's fine. That's probably not going to do any harm. But you definitely should be using good quality pain medications like non-steroidal anti-inflammatories. You should try to make sure your dog is not overweight. You should consider physical therapy, which is a growing, still not entirely proven, but definitely a more plausible method of therapy for chronic pain, you should definitely not be using acupuncture as the primary or sole therapy because it's probably not good enough if it's doing anything at all. I hope this has been useful and interesting. Thanks for watching. We'll see you again next time on SkepVet TV.